right, Dr. Blumenthal back with you, and we have Micah. Micah, you may remember we did his transplant about a year ago here in the DC office, and he is back with really nice results. We're both really happy about it. But Micah, share us the good and the bad of the year. How'd it go?
Yeah, obviously there's a little bit of discomfort, going home and you've got the sutures and the tightness and,
Yep.
they give you medication for that. So, it helps you relax a little bit and take the edge off, I guess. And, depending on your personality, you might be a little bit anxious along the way. I certainly was like, just kind of waiting and waiting, seeing the progress.
Yep.
But, I am very, very happy
Awesome.
with how it turned out.
There can be ups and downs through the year. It can be a long year. Yeah.
Yeah.
You got to be patient with it. Yeah.
Yeah.
Yeah, and ultimately, though, I think, wow, what a difference. We'll put up the before pictures as well, too. But I'm going to pull your hair back just so we can see here. And he's got wonderful thick hair behind it, which is fantastic. But obviously, the transplanted density is not going to match that. But he definitely got his 30 to 40%. And, we were talking about potentially doing a second coat at some point, which I think would benefit him. I don't think he needs it, but, it would definitely add some pop, depending on how old you are and what your expectations are. I think you can, you obviously make an argument about it, and I think it would improve things. But like we said, I don't think he needs it, which is great. The temples look really good. Awesome. We'll put up the before pictures alongside here. And then we did a little bit of the crown as well, too. Come back. So there's a little area in the crown that we did right around here. That's thicker as well, too. Love it, man. Thank you for doing this.
Yeah,
everybody.
Absolutely.
And now that you've been through the before and after, what words of advice for people that are kind of thinking about it, contemplating, doing the research? What would you recommend? Now, if you could do it all over again, what would you recommend?
I'm very much thinking about doing it again, and I would just say that if you're anxious about it or not sure, it goes by quick, and you won't regret it. So
I second that. Awesome, Mike. Appreciate it, man. Thanks for doing this.
Of course.
All right, man.
Take the first step to better hair. Call 844-327-4247 to schedule your free virtual consultation.